It's nice to see you. Welcome to the Urgent Care Centre. What can I help you with today? I'm sorry to hear that. I can see that your face is a little cut up here. Your leg too. Okay. Well, before I check on all of that, do you mind if I confirm a few details with you first? Okay, thank you. So, can you tell me your full name? And your date of birth? And the first line of your address? Okay, good. So we have your record here. Are there any other medical events since you last saw your primary care doctor? Or have you started taking any new medication that I should be aware of? Okay. So, let's start at the beginning. Would you like to tell me what happened? Okay. Was there any alcohol involved by any chance? No, just clumsy. Okay. No, I believe you. I did something very similar when I was 21. Completely ruined this portion of my face, but I think you can barely tell now, so I wouldn't worry about any aesthetic or cosmetic concerns. I'm sure it will heal just fine. Can I ask why you came in today rather than just see how your body healed on its own? Okay, you're worried the cut might be infected. Okay, let's take a look. Okay. Gonna point my light at it if you don't mind. I'm struggling to get a good visual. You're right, it is a bit dark in here. So okay. So it's not infected. In fact, that is just the body's natural healing process. The reason it can look a little bit yellow is that is what happens when your antibodies, so the things in us that fight infection and all sorts of illnesses and disease, when they come together and form a scab, which is essentially what you have on your eye there, they can get that yellow tinge. So that's all good. It's not infected at all. I understand why you would, because yellow can be a concerning colour in cuts, but it's generally only concerning if the wound is draining that fluid, really, not if it's in a kind of gelatinous assemblage like just here. If it was an infection, then we would expect to see redness around the wound that grew days after the wound was created, because a little bit of redness is normal around the affected area, but if it starts to grow, that would be a concerning sign. Also swelling of the area that also grew after the event. A little swelling is normal, but it should go down rather than up. And another thing would be heat, because when your body is trying really hard to fight quite a nasty infection, As you know, if you've ever had a fever, it raises the temperature around it, and this is to kill bacteria. So those are the things that we could be concerned about. We'd be especially concerned if there was a red streak coming from the wound, as that would be a marker of possible sepsis. And if you ever get that, go straight to the emergency room or A&E, depending on where you are at the time. So yes, you've definitely not got an infection and it's all okay. Is there anywhere else that you're concerned about? Okay, your leg. May I roll your trouser leg up just to have a look? Okay, thank you. Okay. Well, I would say that's most likely the same thing, but would you like me to wash the wound just to give you peace of mind? Maybe put some antiseptic on it, and put a bandage just to protect it from outside bacteria and pathogens. Okay. So, apologies if this is a little cold. Some antiseptic on it. And finally, we'll put a bandage around it. Just pull it off my roll of bandages here. And then we'll just tape it. I think you have to use specialised medical tape, but I just use Scotch tape and it's never failed me before. Okay, that's your leg all bandaged up, and I shouldn't think you'll have any trouble with it. It's all protected from the outside pathogens of the world. And the really cool thing about bandages is that they are antimicrobial in themselves, because they have really, really tiny amounts of silver impregnated into the fibres. Silver is antimicrobial in itself, and it just helps to keep the wound sterile. I think that's really cool, personally. And just because the wound was quite close to your knee, and I can see that you've got quite a big bruise on your knee also, do you mind if I just test your reflexes around that area? Check that everything's moving properly. Can you just bend your leg from this position to this position? Okay, that's good. And now I will just make sure that you've got the classic knee-jerk reaction. I know lots of people don't like this feeling either, but just because I can tell you're a little bit anxious, I just want to make sure that we've covered every basis. Okay, so I'm going to make a sound with this, and then I will test that you can feel it on either side, and then I will do the knee-jerk reflex. Okay. Can you feel that? Can you feel that? Okay, good. And now the classic. Okay, that was a very healthy knee-jerk reaction. So when you fell, was there anything else affected? Okay, well, we probably should have started with that. Things like scabs and cuts are often not very serious at all. All you need to do is clean the wound and then just wait. And they tend to be more cosmetic and aesthetic issues rather than anything that's a long-term cause for concern. But anything to do with motor and mobility, that's the stuff that really needs looking at. So can I have a look at your hand? Okay, thank you. Okay. Just feeling along your fingers. Okay, I can feel that that's a little bit swollen around your index finger on your left hand. And now I'll check your right. If you can just pass me your right hand. Okay, so your right hand seems to be okay. Your left hand, there is quite a bit of swelling on the left index finger. So we'll just try a few exercises. If you hold up your hand for me, and just do what I do. So we'll start this, and then do this. Don't worry if other fingers come down with it as well, because that's just a natural reaction. Okay? Okay, and then pull it up into a fist, and then release, and into a fist, and release. Okay, and try and do that quickly. Okay, so it does seem that you've lost quite a lot of the dexterity in that finger, which is a bit concerning. Let's quickly do the right hand before we talk about what you should do there. I just want to double check that there's nothing wrong with that one before we go all in on the left hand. Okay, so I'm going to lift up my left hand, but you lift up your right, because I grated my finger the other day. I was grating a carrot. I was trying to grate a carrot and then just ended up grating everything within a 10 centimetre radius. So that's limiting my movement at the moment, but it's not a bone or ligament issue. It's just that the skin is healing right now. So your right hand, my left. So okay. Okay, and then pull it up into a fist, and release, and a fist, and release, And just do this for me again one more time. Okay, and now this really quickly. Okay, so your right hand is fine. So what I would say about that finger is that it needs an x-ray. Yeah, I know it's a lot of trouble. Well, I appreciate you for being honest with me. Do you really not think you'll go? Okay, well, you can just go home, make sure that you get a cold compress on the finger, try and help the swelling to go down. But if it doesn't get better after about a week, then I would definitely go and get it x-rayed, because if it's a broken bone, which I don't think it is, but it's always worth checking, or a torn ligament or anything like that, if you don't get it treated too early, it can change the way that your hand moves, and it can kind of heal in a way that is not beneficial, basically. Whereas if you go to hospital, then you can make sure that they do everything to just get the function of that hand back. But as you say, it may well just be, and it's more likely to be, the swelling causing that issue. But please do go if it doesn't get better after a week. Just make sure not to do any further damage to it. Be really, really careful when doing anything like cooking, cleaning, and don't even think about doing anything heavy duty until it has either gotten better or you've been to have an x-ray and you know what's going on. Okay. Well, it was nice to meet you, and I hope I don't see you again soon, simply because I hope you stay happy and healthy. But please remember what I said about that x-ray. Okay. Well, have a good day, and I may see you at some point in the future.